is that the Burlington All right, how are we doing, Olivia?
We are live. We're ready to go.
Okay, great. Welcome everybody. Sort of a hot Friday, casual Friday, over 90-degree Friday version of the briefing. Thank you for joining us. We got a lot to cover. We got full posse of guests who are gonna help us with this update. We're gonna start. Dr. Leffler's here. He wasn't able to join us on Wednesday this week. We're really pleased to have you, Dr. Leffler, on a Friday. And let's start by talking about the status of the virus. From my perspective, we got so much terrible news happening around the country. It is the national embarrassment that is the country's response to the virus just deepens with every day. We've been having almost record-breaking numbers of new infections across the country. I think we got to point out and sort of end the week on another good note. That is not the Vermont story right now. It could return. We're all worried about it. We're all on guard about it and staying vigilant. But the Vermont story continues to be a success story amidst this broader failure. There is the COVID Act Now website. Again, anyone who's tuned into these briefings, we very frequently check in with this website run by data scientists and public health officials. Vermont, they don't actually have like daily stats on here. My intuitive sense is that Vermont has been green more than any other state throughout the epidemic. Green meaning the virus trends currently are under control. On the right is from our dashboard, which really has lined up well with this the map on the left, in that we had a period in early June where we went yellow, and then we got it back under control. It went green again, and that's what you see on the right side of the graph there. A spike in early June when there was this significant outbreak in Winooski and Burlington, and then that outbreak was contained, and we continue to see an average of about 5 cases a day, and the 7-day average there. We had a big day 2 days ago. There were 11 cases, but yesterday we were back down to 2 in Chittenden County. So this is what the good news looks like for the future. We will have some outbreaks. The test is whether we can get them back under control. Vermont is showing that that's possible here right now, and I think we're all dedicated to keeping it that way. This jive with what you're seeing up on the top of the hill there, Dr. Leffler?
Absolutely, Mayor. So I think that this United States chart shows the difference between having a coordinated response and an uncoordinated response. And we've been saying this at almost every call since I started joining you back in March, that to this point, Vermont, its government, its cities, its healthcare system, and its people have been coordinated in our response. We've all been working together. And so if you do that well, we've proven that you can get the virus under control, that you'll occasionally see little spikes like we saw in June, but we quickly were able to tamp that one down. I think we can say now that one was a success. We managed that one. We're a month out from that, and we did not have a big outbreak. And we can clearly expect more of those. There are going to be episodes where we see cases spike up. And when we do, quarantining them, getting it back under control, contact tracing is going to be how we keep green. So I think, like I've been saying now for a long time, Vermont has done a good job to this point. I think the really important thing for people to remember is that this is a game. We're just finishing, maybe if we're lucky, the first quarter. There's a lot of coronavirus in front of us. And it's going to be hard because people are fatigued and they're worn down by this, and they're tired of hearing about it on the news, and they're tired about taking some of these steps. But we have to be in this for the long term. And so I think it's really important for people to we should congratulate ourselves for a good first quarter of this game, but there's a lot of game left. And if we get complacent, or if we take our eye off the hard work that we've been doing and start focusing on other things, we will quickly be yellow or even red. So, and the steps aren't hard to do, but you have to do them consistently, you have to do them well. So, we're getting ready to have our students come back into our colleges, which is important. It's important for learning. It's important because those are great institutions in our communities. There's a lot of planning going on around that, and I'm comfortable that they can do it well, but that will introduce, without any question, some coronavirus into Vermont. We're going to have to be ready for that and deal with it and manage it.
So, we prefer baseball analogies here in the mayor's office. So we're thinking it's like the second inning. Maybe we're moving towards the third. But yeah, and it's why I keep coming back to this, not in any way to say, look, great, we've done it. But it is because it is this long battle. And I guess I just want Vermonters to see that their sacrifice is making a difference. And I hope it is energizing to people to see this data. I hope it is validating, and instead of us, I hope that in and of itself, the success breeds more success, and then we stay committed to it. Let's talk a little bit more. It's amazing to me how it's just been such a fascinating process. I wonder if there's anything quite like it in history, where our understanding of a disease, of a medical issue has evolved so dramatically, so quickly. I thought some of the new science coming out just this week, was kind of shocking. I certainly, until this week, understood this virus to be something like the flu and something akin to the prior pandemic, 1918-19, the great influenza then, and that this was clearly a respiratory issue. I was stunned to wake up Monday and hear Donald McNeil, the New York Times science writer who has been right about so many elements of this, starting to report out that although this virus gets into the body through the lungs, it's actually less of a respiratory issue than it is, I guess vascular issue might be the right term, that this gets into the blood and has impacts there. Have you kind of begun to digest this revelation, Dr. Leffler?
Yeah, so first off, your first point is a good one, that the knowledge that we have is evolving fast, but you also have to be a little careful on that, because sometimes things come out and then under more careful scrutiny, or what we call in medicine peer review, they learn more. And so, we've learned a lot about masks. We're learning more about how the virus is spread, who are bigger risk for catching it, how people spread it. So the most important thing, I think, for people that are listening today to understand is that it is spread by a respiratory method.
Yeah.
So that's really important. So if you're going to catch this, you're going to catch it by someone coughing, sneezing, yelling loudly next to you, not wearing a mask, too close, crowded space. So that's number one. You're going to prevent yourself from catching it by doing the same things we've been telling you. Then once it gets inside your body, there's now a number of different ways it attacks people. Some people have very mild symptoms and don't have much illness at all. Some people get a mild, relatively uncomplicated upper respiratory infection, like a flu or cold, mainly lungs. Some people do get very sick from lung infections. Some people do get critically ill from lung infections and need to go on ventilators for that. But almost everybody who gets very sick has a huge problem with blood clots. And they basically start making clots throughout their entire body. They make clots in their other organs like their liver, their kidney. Some people are making clots in their extremities, and people are actually making clots inside their lungs. It turns on your clotting factors, and it damages the inside of your blood vessels in a way that makes clots a huge problem. So for some reason, this virus has an impact on our clotting system. And we know a lot more about that now than we knew in March. And at the hospital, when we see people get COVID and that are sick from it, we have ways to help combat that early on. But that is a very interesting component of this illness. It is different than the normal flu. But I do want to make sure people understand it is a respiratory infection. Okay. It has other impacts.
All right, I appreciate the
cardiovascular.
Yeah, that's great. Thank you that was exactly, I was hoping you could give some wisdom just like that. So can you just say a little more? Does the understanding now of this clotting risk change the way and offer the kind of chance of some life-saving therapies directed at that phenomenon that were not sort of pursued early on?
Yes. So the trick is making sure that you give it to the right people. So once again, for most people that get COVID-19, they have a relatively mild to moderate course. They're not making blood clots that would be life-threatening or really hurt them. And so they don't need anything. But for people who get sicker, there are medicines we can give to thin their blood, but that comes with risk too. So it's a risk balance. So I don't want people to leave this call thinking that everyone who gets a positive COVID test needs to immediately get on blood thinners. That's the wrong information. But we do know now people that show up in the hospital and are sick with this and require hospitalization. Blood thinners for some of those people makes a huge difference in their outcomes.
Great. All right, let's another I think undertold story of this pandemic is, and part of that Vermont success so far that we've been talking about is that I don't know. Sometimes I feel like, Dr. Leffler, we're in like a different universe than all these national stories about there not being testing strategy, not enough tests. It feels a little bit incongruent with what has been going on here. And you can see it in the numbers here. This is also from our dashboard. There's been an enormous ramp up in the amount of testing happening I think this is all the whole state. So on a daily basis, you can see the state has really met its goal that it was established, I think, back maybe in April of getting to 1,000 tests a day. Looks like we've sort of plateaued at that point in terms of this testing. But I think that's not the whole story. I know that there are some other efforts going on that maybe aren't being captured fully in this data. Well, what's going on at the medical center now in terms of the testing, and how do you think we need to keep ramping this up? What's your sense of kind of the state of this critical containment strategy? It really is the most important containment strategy, right? Is having good testing capacity.
Good testing is critically important. So I think there's a couple things on this chart that are important. First off, if you look at March 1st of 2020, we had the capacity to do 0 tests for COVID in the state of Vermont, none. And then we went through some early trials and tribulations to get some testing going and start testing really important people. And early on, we were saying we only had tests for people that were very sick and we were highly concerned about COVID. And we were ramping up to this magical number of, if we thought we could do 1,000 a day for the state, that would be a good number. And so if you look at the data we have over the past 3 to 4 weeks, Vermonters have needed a little less than 1,000 a day. Like most days we're doing 800 tests, 900 tests, in that range. So 5,000 a week right now, Monday through Friday, is meeting the needs of Vermonters. That's enough tests for people who are getting procedures in the next 3 or 4 days. That's enough tests for people who are showing up sick and we want to prove they don't have COVID. That's enough tests for people who want to come off quarantine before 14 days. 1,000 a day. It's important to know that when COVID comes back to Vermont in a bigger way, and even with that great slide we just showed, we're going to have some challenges with COVID in the later innings of this game. Somewhere's coming up in our baseball game, there's going to be some more COVID challenges. It's likely at that point that 1,000 a day may not be enough. That to maintain everything we're trying to do, we could need more tests than that. And we are still somewhat challenged that there's basically 4 different machines and test kits that we use to test for COVID right now. And there's a rapid one that's in very short supply in Vermont. We only get about 300 of those tests, I think it's per week. So not enough to do everyone rapid, which would be perfect, but we can't do that. And some of the other tests, there's reagent challenges, having enough of the chemical to do them. So I was on a call with the Commissioner of Health earlier today, and I personally think that having multiple different ways to do the testing is important because it keeps our options open. And you should know that some of our tests, the rapid tests right now that would normally be coming to Vermont, they're going to Texas and Florida because they need them right now. So I think it's important for us to have, and at the medical center, we can do tests at least 4 different ways. And we think that allows us the most flexibility for what may come. And we're trying to have more ways. And we're trying to make sure that we're not only limited to 4 so that we have maximal flexibility. So I think right now for Vermont, in that green situation, 1,000 a day is meeting what Vermonters need right now. But I think ultimately we could need more than that when we get a little more COVID here. And I think we will need to increase our capacity, and we're working on that. But right now, a lot of testing capacity is going to other places in the country that are in a tougher spot. And you've seen that on the news if you're watching, where there's huge lines in Houston, Texas, and huge lines in California, people trying to get testing and then waiting a long time to get the results. Yeah. I don't think we'll get in that situation, but it's a long answer to tell you, I like where we're at today, but I do want more testing capacity.
Good. As I have said publicly before, we had our first coordination meeting with UVM, Champlain College, and the state about the fall return of students. And, I want to have the colleges, the university back on this briefing sometime soon to talk about it. I think we'll be reassuring to the public to know the level of planning that's happening there. Testing, I don't want to get into the details here yet. I'm eager to share the details, but they're still being worked on. What's interesting to me is there's campus-specific testing strategies that are clearly evolving now. Is that something that like every organization should be starting to think about at this point, and that wants to be operating during the fall? How would a sizable organization like the city, would you recommend thinking about testing needs we might have to sustain operations going forward, and other organizations like the city?
Well, I think every organization should have a plan for how they're going to manage ongoing operations with more prevalence of COVID in the community. So we completely shut down Vermont the last time. I'm strongly hopeful that we don't have to do that again.
Agreed.
And the way we can maintain keeping things open is to have very clear plans for what we're going to do when we see little spikes in cases. And so I think I applaud the colleges for building a good plan, and I've seen some of the work UVM is doing, and it looks like a very comprehensive, well thought out plan that I think will keep their students safe. I think it'll keep the prevalence of COVID down in Burlington, and I think it's a good plan. And I think organizations should think about how many people are the right people to have at work right now? What's our masking policy? What's our quarantine policy when there's an exposure? How are we going to manage our workforce through that? I think that's all good work. Whether or not you should have on-site testing, I think depends on the size of your organization. I think it depends on risk and what your local health capacity is for that right now. So I think if we said we were going to try and take on all of UVM at the medical center, that would tax us a bit. But we've been working with UVM, so they're going to build their own plan. I think that makes sense. For a small business that has 30 employees or something, I think it looks different.
Yeah. All right. Well, good. That's thank you for that. And I think one last thing we were hoping to talk a little bit about, and there was some new science here too. I think to your point, not definitive, I don't think it's gone through all the vetting that ultimately it's going to need to. But at the same time, I think we should not just talk about the negatives going forward, where there are some hopeful elements, I think, starting to kick them around, not overlearn these lessons. But there has been increasing science focused on, there's been these big questions about the susceptibility of children to infection and whether children could pass on the virus even if they are not symptomatic. Have you seen anything interesting in these reports that has caught your attention, Dr. Leffler?
Yeah, a couple things. So first off, children definitely can catch COVID-19. Luckily, the vast majority who catch it have a mild illness, don't get very sick. There are occasions when children do get sick, but that's very rare. Most kids have a mild infection. And there's some reason, some people think it's because they've had other kinds of COVID recently, meaning it's a common cold virus. This is just a more virulent one. So kids do catch the virus. What it appears to be is that kids don't spread it as easily as adults. And the current thinking on this, and no one knows for certain, but I like this approach because it makes sense to me. We just started this conversation by saying COVID is a virus that's spread by respiratory means. It's spread when you cough, sneeze, you're yelling loudly. Children have smaller lungs, smaller mouths. And so if you think about a full-grown adult like me, my lungs are big and could hold a lot of COVID virus. And if I was sick with COVID, I could have a lot of COVID in my lungs. And one cough from me could really project out a lot of virus a long ways. A child, let's say a 5-year-old or a 6-year-old first grader, much smaller lungs, smaller number of virus particles, not as strong as a cough. So they just don't project it out as far. And even when they do cough, there's not as much virus going out there. But I want to make sure people understand it is possible to catch COVID from a child, and it is possible for children to have COVID. But for some reasons, and that might not be the only reason, but they seem to spread it a lot less.
Which has some encouraging implications, right? If that holds up and we got to be using this time well. We're only, we're almost pushing mid-July here, only a little more than a month out from when schools would typically be restarting. Certainly the evolving understanding of, I think one of the big implications of that we have to figure out over the next month, if that becomes bankable, if we can count on that phenomenon more, that could explain perhaps it should factor in, I guess, as what I'm thinking, into the planning for school reopening. If it turns out that child transmission to adults is rare, that's encouraging. That's hopeful, and that might mean that some of these plans can involve more in person teaching than we might have feared, if that holds up.
Absolutely true. And so we know, for example, like influenza, the flu, people get the flu shot every year. The flu is heavily, heavily spread from children to their grandparents. Yeah. Children get the flu at school, they bring it home to their mom and dad or their grandparents. Very clear transmission. So far, COVID seems to be not exactly similar to that. So to your point, that I think is good news, that COVID alone shouldn't necessarily, I think we could have ways to have kids go to school and be safe. Good.
Kids be safe, and also the adults. I think the larger concern, I think we're feeling more and more confident that kids are pretty safe, but schools need adults, and some of those adults are older, and we're worried about the safety of those adults. Yep. This perhaps suggests there's some strategies to keep those adults safe.
I agree.
All right. Well, wanted to have that discussion today. I know there's a lot of focus going on right now about the fall planning. We heard new Superintendent Tom Flanagan make some statements about it in the last week. And I thought, as so many of us are sort of grappling with that, this would be a good time to have that conversation. I will just add, I think this is such an important conversation and has so many implications for the fall. I'm really hoping we don't too hastily, I don't know what the right answer is. I want to be clear. I'm not advocating. I don't know what the right answer. I think it's a big question, but I'm encouraged by that science. I think that should go into the mix. I'm encouraged by reports I get at my house from my wife, who works in a youth center, works with early childhood individuals over at the King Street Center, and I'm encouraged by what I hear about the compliance level of the kids in terms of wearing masks, and it increasingly feels to me like this is something that while really daunting, that with this time that we have to plan, maybe this is a way to do it and do it right, and that would really be a great step forward for the community if we're able to do that. So thanks for this conversation. Anything you want to add, Dr. Lefter, before we lose you for today?
No, thank you, everyone. Stay cool this weekend. Be careful. If you have elderly neighbors, please check on them and make sure that they're not staying all day in a super hot house.
Awesome. Thank you for those words. Thanks for your leadership, Dr. Leffer. We'll see you again soon. We're going to keep talking about the virus in a couple other areas. people who have been watching these briefings know, that the way the city's role in virus fighting and virus suppression is limited in terms of what's, we're not a public health agency. We're not a social service agency, but we are looking for every opportunity we can in city government to impact the virus, to contribute to that box it in strategy. And this is a new one in terms of measures out at the Burlington International Airport. And this is one that's in its early stages. Like Dr. Leffler said, we're in the first quarter or the second inning of this battle. And this and what we're going to talk about here represents a start that could expand into something further. One of the things that I've been worried about since the start of this pandemic is that our airport could be a vector for virus arriving into Vermont. We've got this good thing going here right now. We want to keep it that way. The airport, as it starts to increase activity there, and we're up from, I think, a low of what, we got Aviation Director Gene Richards here with us. I'll turn it over to him in a moment. I think we were down to about 1,000 passengers a week or something coming through the airport at one point. That number is up 3 or 4-fold now, still way down from historic averages, but we are starting to see more travel. And this is one of the ways that we could see the virus reintroduced into Vermont. So we have some new strategies for trying to interdict it if that happens. Gene, why don't you describe for us what we're doing now out at the airport to try to ensure that we continue to box it in, and the airport is part of the boxing it in strategy. Gene, you're muted right now. We can't hear you. There you go.
Now? Is that better?
Yep.
Good afternoon. So the role that the airport is playing is that we want to make sure that people coming into Vermont are as aware and safe as possible. And one of the things that we just installed was this thermal imaging, and that has a lot to do with your direction, Mayor. You pushed early on this, and we did the handheld temperature taking, but this is much more accurate, and it can take groups up to 20, as well as it alerts, and it's a really good system. It also will give us reports and let us know what's coming into our community. So we're quite excited about the opportunity to leverage this technology and to see really what's happening and how the airport is contributing.
So describe, Gene, what happens now and what doesn't happen now. I want to paint the picture accurately of what's happening here. People shouldn't be worried they're going to be like, So all that happens is that this has none of your personal information.
This merely has your image. And as the people get off an aircraft and they start exiting the airport, and either on the north or the south, it'll pick up one person or a group of people. And if somebody is running warm, instead of getting a green square, they get a red square, and it basically shoots off a little sound. So it alerts somebody that, someone's running warm. And then we recommend to people, that they either check with their physician or do what they think they need to do. Definitely, we remind them they need to wear a mask and definitely quarantine. And when you say we recommend to them, how does that actually take place, Gene? Is it just through the signage that we see there, or do you have a personnel standing there that what happens when someone is running a fever? We rely heavily on the signage, Mayor. We don't want to get into people's personal business at this point. And again, as we evaluate the data that comes in, we may step that up and may get more involved. But at this point, it's very voluntary, and we just want people to be aware that they're running warm. So it's more of informational right now. And that's the position we currently keep, is just have it be informational and direct them and let them know that they're running warm. Great. And we have information there about
how they might want to follow up with someone to see if this is just a normal fever or if this is actually a COVID symptom.
Exactly. It's just more of advisement and knowledge is really what we're supplying them.
Great. From my perspective, that's exactly the right posture. Well, whether it's right or not, that's really the posture that we've been authorized to take at this point. I think that's about, here's something that I think is going to be a theme of our conversations in coming months is I think having this capacity when we are challenged again in the future, as Dr. Leffler just told us, we should count on. We are going to have times where we could be out of the green and in yellow, orange. Let's hope we never get back to red again. But as we sort of go up the risk scale, this gives us the capacity to take more stronger actions potentially in the future in coordination with the state health officials. If we start to see community transmission again. So thank you for having this set up. You want to describe the other features out at the airport that people should expect if they haven't been there in a while, sort of new things that they should be aware of?
Yeah, we've just added on to everything being hands-free. We also have there's masks that we hand out for people that are traveling, coming or going, to make sure that they are being safe. And again, we're just keeping the airport as clean as possible. And our numbers we went as low as 800, Mayor, and we're up to about 4,000. So, but again, growing too quickly probably isn't the right solution. A steady growth and one that we can manage is probably best.
So that's 4,000. Those are weekly figures there, Gene?
Yeah, 4,000 people.
Great. So that puts, to give people kind of a reference point, that would be about a couple 100,000 visitors a year, which compares to what is it? Right around a million, right?
Yeah, we have about 15 to 17,000 typically this time of the year per week. Okay,
so about a third to a quarter of our typical traveling. So, well, Gene, thank you. Gene, thanks for everything you've done in this pandemic, both getting the airport ready, getting the airport through this unprecedented challenge. But everyone should know Gene's been just an incredible team player as well in terms of the broader city virus suppression efforts. He personally is very involved in the masking effort, the mask fabrication, and getting the masks out to people. He's got some big efforts underway. He's become something of a farmer too. We'll come back and have you back another day to talk about the airport's Plant for the People efforts. I have some confidence we're going to get to our numbers, big ambitious numbers for the amount of produce we're going to generate because the airport team's on the job too here. So, Gene, thank you. I really appreciate you chipping in every way you can to help keep Burlington safe.
Well, thank you, Mayor, and thanks for your leadership. It's a pleasure working with you on this.
Thanks, Gene. So we have another virus suppression effort that I want to give people an update on. This is one we have talked about before, but we've got some numbers now. Everyone knows we like numbers here in Save Burlington. We like data. The supportive quarantine program is something that the city has set up. This is of the 4 big strategies. Again, people have been following these sort of box it in strategies. The boxing it in again is testing, which we talked about earlier. People who test positive, we expect them, we need them to isolate. Once someone has been identified as testing positive, the state runs contact tracing, finding other close contacts, people who are at risk, who have gotten the virus through the person that we now know has tested positive. And then that, usually when it works well, generates a number of people who are identified that have been in close contact with the person who has tested positive. And those people are ordered to quarantine by the governor. And quarantining is hard. Quarantining is harder than what we all did during the stay home period. We are all ordered to be at home, but we were allowed to go outside for exercise and to go to get groceries, get medicine, to do essential tasks, to go to work if you were an essential worker. Quarantine is stricter than that. Quarantine is you are supposed to stay on your property and you're not supposed to leave until we are confident you don't have the virus. It's an important strategy for keeping the virus from spreading and keeping it contained. The city, there isn't really anybody's supportive quarantine is sort of a new thing. We haven't done it here in America before, ever, I don't think. Maybe they did something back in 1918, 1919. And it's not really clear whose job it is. So the city of Burlington has stepped up and said, we're going to try to do this job and try to make it easier for people to quarantine. And the point person on this effort has been Zach Williamson. We've been doing this for a month and a half now, since the beginning of June. And we've got some encouraging results about how this program is going. So Zach, why don't you bring people up to speed on where we stand with this? And we have updates. We've reported before this first bullet that we've had about 200 people go through this. 120 of them are done now with this, and many more will be completing it in the coming days. We have some new data today about a survey that we have put out there to those people that have completed the program. And it's, to me, it's encouraging. To me, it's a sign that this is a strategy that is meaningful, that's having an impact, and that we should stick with. Zach, why don't you share with people what we found?
Sure. Yeah. Thanks for having me back, Mr. Mayor. I'm really pleased to be here. Yeah, as you said, this supportive quarantine, and I've been on here before and kind of talked about how it's really an amazing thing to be part of, and it continues to be. As you said, we have more than 200 people who have participated right now. That number is 212, and we're up to actually 131 who have graduated. Just the numbers keep changing. So that's as of right now, that's the current statistics. But yeah, as you mentioned, it's really encouraging to get some of these survey results back. They're overwhelmingly positive in terms of how they felt about the program, if the program was effective, because, we obviously weren't sure what was going on in these people's lives. We reached them as much as we could, and we were pretty successful at that. We contacted them daily or as close to daily as we could. And it was really, we have to rely on the actual people who are moving back to do the right thing. And so it was great to see, as you can see in these, in this slide here, that, 84.5% said that their experience was positive or very positive. And then a very similar number, 87% said that, they mostly complied with the order. And that's pretty incredible, I have to say. Obviously not. Yeah. Not everybody did. But what I talked about, I think the last time I was on, is that any education about quarantine or any step towards doing the right thing is a good step. And so as we gave people to kind of choose, did it help a lot? Did it help a little? Did it at least increase your compliance a moderate amount? And so you can see even 33% said that they, kind of admitted this was an anonymous survey. They can admit, like, I didn't play by the exact rules, but it did increase my compliance a moderate amount. And that moderate amount could be just enough to keep everybody safe. So it's a pretty great program in that regard. I think, right now what we're seeing is we are the people moving to the area and registering are starting to slow down. But what's interesting was, I think, a lot to UVM's credit of getting the word out to people who are planning on coming back. We kind of are taking almost pre-registrations for people who aren't getting here until the end of July or into August. So we actually are already registering people who actually aren't going to be here until August 1st, 2nd, or that first week of August. And that kind of ties into the point that I want to make, that we are looking at how we did in the month since we launched this program and how we can ramp up if we have to coming into the next month of August as students return in a greater number potentially. And so we're just looking at our systems there, and we are working with UVM to kind of work with some of their staff to go at this as a little bit more of a joint effort and work with them in some of the daily tasks that actually take a lot of staff time from city staff in terms of contacting people or getting gift bags out.
Excellent. Why don't you just, for people who haven't seen the prior briefings, just remind people, or for people who have seen the prior briefings, I guess, remind them. For people who haven't seen them, can you just summarize again quickly what the supportive services were so that everyone's clear on that?
Sure, definitely. So when someone registers at the Resource and Recovery website, you can register very easily for the to participate in supportive quarantine. It's a very simple registration, and in that registration, you can tell us when you're getting here. And also, we have a couple options there to say specifically if you're concerned about something, you aren't sure how to quarantine, you need help with getting groceries, you figure you're going to be stuck in your apartment. How do I get food? If you need any kind of social emotional help, there's an option there, or also unemployment. You can't go to work during this time. So we're there. We kind of give you some preset options, and then anything else you want to tell us, we get all that information, and immediately you get an email from me that welcome to the program, addresses some of those top concerns, and you get linked up with a city staff person who then kind of is your not case manager in some ways. You get calls and emails from them every day of your quarantine. And trying just to not, we're not beating you over the head with this kind of information, but making sure if you do have any questions, we can answer them, making sure that we can support you the best that we can to make this a successful quarantine. Then after that, I skipped the welcome bag. Also, when you first get here, we deliver a welcome bag. That bag has more information. It has a sheet from the state of Vermont about what does quarantine mean. And then it has a library card, which is fantastic. So that people can access the digital features on the library's website, and it often has a treat of some sort that kind of just takes the bag to the next level.
I thought that was a essential item.
It is an essential item. It's true. Sometimes we run a little.
I've not had a star item of the day photo on this briefing, Zach.
That's true. I got to get on that. I know. The star item is good. We have had Miss Weiner's Donuts, and Great Harvest has helped a lot with gigantic cookies that go in the bag, and they truly are a star item. There's also, of course, masks and hand sanitizer in your bag as well. So we get that delivered to you just about the day you arrive or the second day. And then after 4 days of successful quarantine, you get a gift card to a local restaurant that can do delivery. That is a great incentive. It helps the local restaurants in this time of recovery, and it also helps kind of get people to go that extra mile, make it to day 7 if they're going to get tested at day 7. And it's just a nice gift. And the response, while we got very positive quotes, as you can see here from the actual survey, the responses I get back from the gift card are amazing, and people are shocked and really thank the city for that support and are appreciative of that effort. So
we joke about these things a little bit here, but my hope with this program has been that these items, that this is substantively a help to people getting through this challenging effort, and also that these little perks, if you will, and they're modest, and we've structured them in a way that the money spent on them is going into Burlington businesses that need help, that they kind of nudge people in the right direction, that there's sort of a psychological encouragement to people to make good on their commitment. They take a pledge at the beginning of this.
Yep. And
these are kind of little reminders to take that pledge seriously. I'm really encouraged by the numbers in this survey here. Again, let's just pull out of here. It's on the screen there, but I want to make sure it's jumping out of people. Almost 90% of the people said they complied completely or mostly with the governor's order. And then of that group, 75% said that the program increased their compliance either a great deal or a lot. Is that the way to read that? A great deal or a lot? Are those two different?
No, it was one option there.
Okay, so that's one. 42% said that, and then 33%, an additional 30% says a moderate amount of increased compliance. So 75% overall, people said the program helped. There's probably some survey bias in this. I think we should acknowledge, right? Like probably It could well be that the people who responded to the survey, which was a pretty high survey response rate for this kind of thing. But still, 30-40% of the people, I think was what I saw, responded to the survey. Maybe those are the people that are most motivated and most likely to, maybe there's a bias there towards, maybe the people who the program didn't do much for also didn't bother to respond. But still, to your point that this is harm reduction, we're just trying to make an impact on this, and any little impact could be critical, could save a life, really, could slow the spread of the virus and save a life. This is a harm reduction strategy. It looks like it's working. We are, to the last point, not only are we evaluating our systems, we also are in conversations. I've reported these results to Dr. Levine. and the state, and as well as our partners at UVM and Champlain College. And, I do expect this to be part of the fall return strategy. And more than that, and I say this here because I don't think this program is fully integrated into all the state's efforts. And people who are watching the briefing should understand the kind of division of responsibilities here, and the fact that we are not the Department of Health, that we are, and that health data is very carefully protected for good reasons, to protect people's medical privacy. With this population, the UVM and Champlain College population, we knew who to target this program to because people signed up with the help of those institutions. There's a whole nother group of people who are directed to quarantine, who we don't have direct access to, but someone watching this briefing may know that. Perhaps someone watching has been asked to quarantine themselves, or perhaps someone watching is a doctor who has advised people that they should quarantine. This is a service that is open to anyone in Burlington that is under a quarantine direction from their doctor, from the Department of Health. And we're here to help anybody. And we want to make sure this word gets out and that this valuable service is available to more people. I even think there's some chance that this should be expanded beyond the, Burlington, and the city would be willing to kind of be a partner in that. If people quarantining outside of Burlington wanted this service, we could work with other municipalities about that. So Zach, thank you for your leadership and your hard work to make this possible. I love that, Zach, people should know, with his day job, is the guy who makes Jazz Fest happen, or contributes to that as a partner, that really runs the Festival of Fools and the Highlight New Year's celebration. Because our responsibilities have been cut back so dramatically in all those areas, we've been able to take Zach's skills and help put them to work on a variety of virus response efforts. And Zach, thank you for throwing yourself into that and helping keep Burlington safe.
No problem. It's been my pleasure. And I actually think I'm talking about two more of those efforts.
Well, we're not done with you yet.
Exactly.
Excellent. Sorry, I didn't mean to rush you out of here.
No, that's okay. That's okay.
So, let me just, on open streets, it's a little bit different here. This isn't it is a public health strategy in a sense. We want people outside, not inside. But we also, this is a relief effort too. This is a way to help struggling Burlington businesses get back on their streets. Tomorrow will be the third Open Street Saturday. Those are some great photos of how it's working. Tell us more about it, Zach.
Yeah, for sure. I know we've talked about a little bit about here before, but as you said, tomorrow, Saturday, the forecast is a little daunting, but we're going to be out there. So every Saturday from noon to 8 p.m., we close to traffic and therefore open to people and stores. College Street from North Winooski to Pine Street, and Bank Street from North Winooski to St. Paul Street. That allows, right now we're at 18 different businesses that are participating. It allows those stores to safely push out into the street. You can see in that picture there, Tail Feather makes a great use of it. Push out into the street and either sell merchandise like Tail Feather is, or in the adjoining picture is Sweetwater's, is seat people at tables in the street. And so they can increase their outdoor capacity, incredibly, really. And that allows allows the stores to accommodate more people, and it allows people to be safe in their support of these local businesses. So you can see right there at Sweetwater's, there's a lot of distance between those tables, and that's really what we want to see as people are getting out there and supporting the businesses. So it's a huge effort that the city is doing to really help these businesses in this recovery and in this relief. And we did get very positive results after the first two. It was the busiest day at the Marketplace Garage. It was the busiest day on Church Street since this all began. Still nowhere near the normal summer numbers, but it is clear that this program helps. And I really just encourage people to get downtown to experience this event. But more than experiencing the event, it's really about supporting these stores that we're going to want to have there when this is all over, for sure. The local businesses are what make downtown Burlington so exciting, and we want to be able to keep them around and help them through this really difficult time. So it's been awesome to work with these businesses so closely. Normally, as you said, I'm doing Festival of Fools, and we're talking more about how many people are going to be in the street. It's going to be too crowded, and how do I get people in my store? And this time I get to work with these same businesses and really ask them, like, what can we do to get you out there and support you in using this program to the fullest benefit. So it's been a really, really great program. I think, it is only going to get better, I think, as people learn about it. I will say that we've had, the initial response when anybody close a street in Burlington is that the traffic's going to be horrible. There isn't going to be any parking. There's still plenty of parking at the Marketplace Garage, and you can get there. You can still access Center Street. There really hasn't been particularly because of the downtown Burlington isn't as crowded as it might normally be in the summer. There really aren't those parking and travel challenges that people might assume. So it's not something that should be avoided. Instead, definitely come out and check out Open Streets every Saturday through the end of August, noon to 8 p.m. in downtown Burlington.
And it's great. I really like these photos. I do hope businesses that could benefit this. We really want every business that could benefit from it, taking advantage of it. We know it's hard for businesses. As you can see there, it requires some new equipment, new furniture for businesses to take advantage of that. If that's a barrier to you as a business, getting your business outdoors and participating in this, the city has some micro grants that we can help with. Way back in the background there, way down the street, you can't really see it in the photo, but Faux Sun had an installation last weekend, I believe, and they were a business that we were able to help them a little bit in terms of getting a good professional looking outdoor presence. And the CEDO team is prepared to keep working with other businesses that want to be part of this. I wanted to speak about the safety element of it just a little bit more here, because I do hear this a fair amount now, like, people concerned about crowds on Church Street, concerned about people not wearing masks on Church Street. And, let's talk about that, and let's talk about what the order says. First of all, the science is increasingly showing it, just confirming that because this happens through respiratory infections, where you have good ventilation, and outdoors there's sort of maximal ventilation, where you have a breeze, where you have air circulating, you just don't have the conditions that result in the aerosol virus passing from one person to another very frequently. There are no documented cases of sort of strangers passing the virus to one another because of sort of a quick passage on the street or on the bike path if you're not wearing masks. The governor's order does not require masks anywhere. The governor's order, Burlington is different. We say when you're going into retail establishments, you are required to wear a mask. I think we're pleased with that policy. We think it's working. Outdoors, the governor has encouraged people to wear masks if they are coming into contact with large crowds, if they are going to be in a sustained, less than 6 feet away from someone from another household for a sustained period of time. If you are exercising, if you are generally keeping yourself more than 6 feet away from others, the governor's recommendation is not to wear a mask. And I think that's the right posture for now. If we get to a period again where we kind of are out of the green risk level and we're seeing higher levels of community transmission, that could warrant a change in posture in terms of what outdoor masking is required. But I think where we are now, given where the science is now, I think the governor's order makes sense, and we're asking people to be educated about what the governor's order says. All right, so that's the Open Streets Plan for the People. Where does that stand, Zach?
Plan for the People is the really great program where we encourage Burlingtonians and really anybody in the area that wants to plant more vegetables this season, victory garden, if you will, but realizing that people are at home more and realizing there is a need for more local food and that a lot of people are facing food challenges right now. We encourage people, and we still are encouraging people, to plant extra produce, plant a bigger garden this year. Earlier in the growing season, we did have 2 really successful plant distributions working with Red Wagon Plants. But now at this point, anyone who's growing a garden should look up Plant for the People at the website right there. And you don't have to register, but it's great if you do. But you should know that you can bring any amount of produce to our collection sites, which happen. We have a special one coming up this Saturday, which is why I'm talking about right now. But tomorrow at Roosevelt Park from 9:30 to noon, the one and only Brian Lowe will be out there collecting produce. So we only have 4 times this season that we're doing Saturdays. And this is our first one, but he'll be in Roosevelt Park, and we gather the produce, we clean it, and then it is delivered same day right to Feeding Chittenden, which is really amazing. Our normal weekly schedule is that Tuesdays we're at Champlain Elementary School sorry, I had that wrong. Tuesdays we're at the Intervale Center. Thursday we're at Champlain Elementary School on Pine Street, also from 9:30 to noon. And we have teams there who, again, are collecting and washing your produce. It really is amazing. We've had pounds and pounds of greens and herbs, some squash. The work is amazing. People know how to grow around here, and it's really, really fun to get to meet the gardeners, see their excitement, and we have nothing but appreciation for people who are bringing in this produce. And then
what are we up to in terms of the total poundage at this point, Zach? Do we have?
I have a number. It's not 100,000 pounds, but we're on our way. I think we're at 235 pounds.
All right. Well, that's like a 10x increase since the last week.
And we're really
very
banking
early
on
in the harvesting season. I love getting texts from friends saying we just dropped off a bag of lettuce. It's great. So
yeah, it's really exciting, and yeah, it's all the light stuff right now. So we're banking on heavier tomatoes and zucchinis coming in. And the last thing I'll say is, it is, if you want a way to help and you're able to grow a garden, it is a direct way to make a difference locally, which is really amazing. So it goes right to the food shelf and goes out the same day. It's really quite a great program.
All right, Zach, stick around. We're about to thank you. I know we're going almost an hour here. We have one last slide, then we'll open up for media questions. Mary Danko is here to share the latest on the municipal service that may be everybody's favorite service, the Fletcher Free Library. And how are things going at the library, Mary?
They are going really well. Thanks for asking, Moreau. Yeah, we're partially reopened, which means we can't do everything right now, but we are doing some things. So we're following the guidelines given by the Vermont Department of Libraries and state guidelines. So we have to keep the capacity down, and you can't go into the stacks to get books, but we have librarians that are here that will go and get whatever book you need. And even if you don't know exactly what book you want, if you're like, I just want historical fiction that takes place in Germany, at a certain time, we can get that book for you. We also, a big difference opening for us is we've opened our public computer center. So folks, we know there's been folks who haven't been able to get online for whatever reason. So all they have to do is call and make an appointment. And we've got certain slots where folks can come in. And then when they leave, we clean the center all up, and then we'll be ready for the next group. We used to have outside pickup service, and we're still happy to bring items out to people if they're not comfortable coming into the library, if they have some underlying health condition for whatever reason. But you can now come in and pick up your holds. All we ask is that you wear a mask and maintain social distancing. And I'm happy to say, since we've been open, everybody's been doing a great job of that. That's really about it for now. Things are going well. The other thing that's happening is our summer challenge program is still going on. And since we can't have it in the library, our youth department is going out into the community. So if you check our website, they're going out to all the different meal sites, and you can get your little challenge bag of all the different activities you can do. There's take and make kits. There's librarians there again to talk to you about books that you're reading, and lots of free books too. So summer is such a great time just to read, leisure reading. The school year's behind us now. You don't have to, read what school wants you to read. You can read what you want. And it's a really good time to have kids keep their reading skills up.
Mary, I didn't know you were doing that. I knew you had been doing some things at the meal sites. That's great that you got the summer reading program, which is such a great library program happening there. Those meal sites have really become a lifeline for so many Burlingtonians to get not just food, but access to other valuable needs during this period. So awesome. Thanks for that. Thanks for the update. Why don't you stick around and see if there are any questions about the library. Thank you, everyone, for bearing with us. We covered a lot of ground there. We got Kieran from CAX in the mayor's office here. What's on your mind today, Kieran?
Well, I have one question for Gene Richards if he's still online.
Gene, can you hear us? Kieran's got a question for you. Do we still have Gene, Olivia? Looks like we do. Gene, if you could turn your camera and mic back on, we got a question for you. Here we go. Great.
Hi there, Gene. I just had one quick question for you. The last time we made it down to Burlington Airport, you guys were looking into a few different thermal scanners for people coming and going from the Burlington Airport. Obviously, you guys have made a decision on what technologies you are going with. Have those been installed and are they up and running yet?
So I'm not sure. Did you have trouble hearing there, Gene? Yeah. So Kieran's question is, he was aware that you were testing out or exploring different thermal technologies. He's asking, have they been installed? And yes, Kieran, you couldn't see because you're here in the mayor's office, but we actually had a picture of one of the installations up, and it's operating now at the airport. The question was also, which of the technologies, and why don't you just describe again, Gene, how the technology works, what it is exactly. And you're muted, Gene.
Hi, sorry about that.
No worries.
So we ended up with two of the different technologies. Both are thermal, and one is on the entry of the airport, and that's a hand sanitizer and a temperature thermo check. The other two are from as you exit the airport from the north and from the south, and basically can do groups of people up to 20 or 30, and as well as individuals. And all it does is if your temperature is normal or below, it will give you a green square, and if you have a temperature, it will be a red square, and then a little horn will go off just to alert you. And that's the level that we have gone so far. We've only been installed about 2 weeks now, and the signage actually has gone in, and but that's about as far as we've gone with it so far. Right now we're waiting. We're going to let it roll out for about a month, and each week we will review the data of people coming in and just the different temperatures of people that have come in. There is no personal information on this. It's merely just temperatures of people and times that the temperatures were taken.
And during this rollout period, will it be letting people know if they have a high temperature?
Absolutely.
Fantastic. Thank you, Gene.
Thank you.
Great. And
Olivia, are there other questions?
yes, we do have a question from Liam from BPR. Liam, you should be able to enable your microphone now.
Great. Hey, Gene, just kind of quick clarifying on this new thermal technology. You said you've had it in place for about 2 weeks. What have you kind of gathered? What have you seen? Any trends stand out to you right now?
Yeah, the skylight affected it a little bit and set it off. But other than that, we've adjusted it, and we've had a couple of people that have come in warm, and we've made sure they were masked and they knew they were warm. But it has not been a large amount of people with temperatures so far. But that's about it. It's the numbers, as the mayor said earlier, are we're somewhere right around 4,000 people for the week, and so fortunately we're not seeing a lot of high temperatures.
Yeah, and so when there's a high temperature and the little bell goes off, do you have people that go in to intercept? I'm just kind of trying to imagine how this whole process plays out. And how you actually talk to people.
And sometimes when there's during the hours that there are people there, they will assist people if they have questions. But we have literature that's there, like a sign that basically gives people what to do, and they may want to consult their physician. They may kind of talks about wearing a mask, being quarantined, just the steps that we have taken. We're really trying not to intrude and get into people's lives. This is more of an informational tool at this point, and we'd like to use it that way. And if later in the process, it needs to be turned into something else, having someone there and maybe guide them, maybe with the state's intervention, the tool will be there if that's something that people want to do.
Great. And then lastly, I mean, with people, the business at the airport is down quite a bit. I mean, do you have any financial concerns looking forward? I mean, how sustainable is sort of the activity that you're seeing right now?
It's not good, and but we're no different than anybody else. I think in the state. So I think we're going to be fine. We did have a CARES package. We received about $8.7 million. That will certainly help us get through, and we are hoping, that the industry gets another care package. But I think there's a lot of folks that need the same thing. So I don't want to be greedy, but I expect BTV will be here when we're done. And if we have to get creative with our financing or do things to make sure that we're here, we will do that.
Thanks so much.
And that is all we have for today.
Great. Thanks everybody for tuning in. Thank you, Gene and Zach and Mary, for your help with the briefing. And we are planning, we'll share now, a Monday briefing going into the city council meeting. One of the things that's happening on Monday at the city council is we're giving an update on our progress towards our net zero energy city goals. So we'll have a kind of preview of that council presentation and an opportunity for members of the media to ask questions about that on Monday. There's some encouraging news from my perspective about the progress that the city has been making on its climate action plan and its net zero energy city goals. So Darren Springer will be joining us Monday for that, a little bit of a break from the coronavirus focus. And we'll see what else we have to talk about on Monday. See you then. Have a good weekend, everyone. Be safe. Take care.